what I remember the most, I guess, was coming to from surgery, in the room, and you were there, and the surgeon came in, and she looked at me, very serious, and just said, "It's worrisome." I said, "Worrisome? It's not really the answer I expected. Worrisome. What does that really mean?" And what it meant was that it had spread, that they found cancer cells in either 2 or 3 of the 5 lymph nodes that they extracted. So, okay, it made it to the lymph nodes. So from there, I had to get a PET scan to find out, where my tracking was in terms of where things would move around in my body.
What I remember from the surgery are a couple of things. Like, for example, I guess we didn't really ask enough questions. Like, we had no idea, was Chris going to be in the hospital overnight? And when they said, "Oh, he's recovering, you can take him home," I was like, "Oh, maybe it's not a big, maybe it's not a big deal." I guess we didn't know what was going to happen. A couple of funny things I do remember. The plastic surgeon who I talked to after the surgery, Chris was still under, and he came out and he was very proud of his work. And he said, "Oh, it went really well, and I was able to line up, the cut along, with a fold in his stomach. It's going to heal up great." And I remember thinking, "Oh, well, he seemed really optimistic." And then we got, the news from the other surgeon, who, did seem a little more worried, concerned.
Well, she explained it at the time, saying that it was because it was close to a blood vein, and so that if the cancer cells were there, it could have escaped and gone into the body. Although she did say that they were just checking the lymph nodes, and she didn't expect that there would be anything in them. And maybe that's just something they always say, but she said it was worrisome.
And what they'd explained was they kept talking about the fact that the cancer had taken root, that the roots had grown deep. And that was what was so worrisome.
Okay, I actually didn't get the diagnosis that early, and I didn't really ask. I stayed with the whole idea that it was just a little mole, and even it went to lymph nodes, it was just a couple little cells. Okay, I do remember the second call though. I was in Connecticut at a business meeting, and I got the phone message, and it's funny because you always know when it's bad news. You get the phone message to give them a call and nothing else. Because if it was good news, they'd say, "Well, give us a call back, but everything's good." But they didn't hear that part. So I waited another day. I called back and I left a message, and I waited another day. And she had said that it spread to the lymph nodes. And then I needed to come back and have a PET scan. Now, because they had taken the lymph nodes out, there was no more surgery to do, but we had to see if she had got it all. Okay. I don't think I actually knew my diagnosis until I entered the study. And that's when I looked it up. And that's the moment, many cancer patients, they finally look online for the survival rates, and then I go, "Oh my God, that's really bad." 3C, I didn't know it was that bad. I just didn't,
I feel, from my perspective, that Chris kind of wanted to keep his head in the sand a little bit. I was immediately, from day one, going online and looking to see what, the various stages were, and, researching everything I could possibly find on it. And of course, when we found out that it was in the lymph nodes, I knew it was stage 3. We didn't get the stage 3C category until after he'd been meeting with the oncologist. And started talking about the study, and we did realize that, this is, not quite the worst diagnosis you could get, but it was getting close.
Well, there's a big difference between stage 3A and 3C, huge. And I was actually surprised when I saw that I was diagnosed C.